Hello and welcome. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Song Brown Primary Care Residency, or PCR, informational webinar. Before we begin, we want to make sure everyone knows who this webinar is for. Today's webinar is for new and continuing applicants to the Song Brown Primary Care Residency Program. The PCR program provides grant opportunities that will result in funding organizations to educate and train primary care providers to work in underserved communities. And it is administered at the state level by HCAI. Here's the agenda for today's webinar. You'll see at the beginning, I'll be doing some housekeeping and introduction, followed by Tracy Chang, our PCR program officer, doing the program updates, application process, and requirements. And at the end, we will have a time for question and answers to make sure we get all of your questions answered. And let's jump into those housekeeping items. Number one, our webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. Today, the chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. And number three, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. The slide deck and the resources linked are posted in the chat, and you can access those at any time. And with that, it is my pleasure to introduce Tracy Chang, Song Brown PCR Program Officer.
Hello, thank you so much, Chris, for that introduction. Again, my name is Tracy Chang. I am one of the program officer for the PCR program with Song Brown. Some information about Song Brown is that we provide funding to education programs, including primary care, family nurse practitioner, physician assistants, registered nurses, midwifery programs, and providing financial incentives to the programs to graduate individuals who practice in medically underserved areas, as well as enroll members of underrepresented groups in medicine to the program, locate the program's main training site in medically underserved areas, and operate a main training site at which the majority of the patients are Medi-Cal recipients. As you all know, we have already released our application as of July 25th. We do have an early submission review date of August 27th, which will also close at 3 p.m. If you are looking for a review by one of the program officer, please make sure that you do submit that application by August 27th. Any application after that will not be getting a review by any of the program officer for PCR. The application deadline is September 10th, and it will close at 3 p.m. And just some information before you apply, if your program does require approval to contract from a coordinating authority, and please inform the authority of the terms and conditions contained in the grant agreement. You can also refer to the grant guide, which is posted to the PCR website. Applicant must agree to the terms and conditions before receiving funds, and HCAI will not make changes to the terms and conditions specified in the grant agreement. Funding shall be used to expand primary care services and shall not supplant existing federal, state, or local funds to provide primary care services. Some changes for 2024. As you can see here, new program strategy questions has changed. Our program data page has changed, and resident data page has changed to collect aggregate data. And additional information to gather for existing expansion in TC. Please make sure that you have the correct organizational name and address. The legal name for your organization should match the address on file with the IRS, and any incorrect information can delay the agreement process. One of the reasons why we're stressing this so much is that some of the applications that we have received recently. It was either using the training program name for the organizational name, and which then we had to reach back out and get that corrected. So if you are needing to find out what the correct organizational name and address is, please reach out to your finance department or your contracts office and obtain that W-9, which is the official IRS document. Another information that you would need to gather is the grant agreement and payee data records signatories. There are times where if you are a returning applicant for Song Brown, there may have been changes in management, and sometimes that information is not updated in our system. And what happens is if you are awarded, and when we do send out the DocuSign packet, it gets emailed out to those individuals who are listed on the signatory section. Please also have the facility type for your each primary continuity clinic training site, payer mix information for each listed primary continuity clinic, and your race and ethnicity data for all current residents. Additional information would be current practice site information for all graduates entered, the NPI number, which is the National Provider Identification Number for all graduates entered, applicable required attachments, which is your ACGME accreditation or ACGME expansion letter. And please make sure that you do have permission from your organization to apply for this grant. For new programs, I like to stress again, please make sure you have the correct organizational name and address. Like I stated earlier, please refer back to your W-9, which is the official IRS document. Make sure the grant agreement, payee data record signatories are updated. Please have the facility type for each primary continuity clinic training site, as well as your payer mix information for each. And for new programs as well, this is something that is different from the existing expansion in THC. For new programs, if you are a new program entering into the Song Brown or applying for a Song Brown grant, and you select yes to each of these phases, each of these documents will be required at the end of your application. For program funding categories, Song Brown provides fundings for existing THC and expansion here. We have provided the definition on each of these slides. And if you are, or if you do have a question in regards to which funding categories where you're not sure if you're eligible for, you can always come back to these slides. Which this webinar will be posted later, or reference the TA guide, or you can email us at songbrown@hci.ca.gov, and we can definitely see if we can assist you in that process. And on this page here, this is for new programs and new programs with match, along with their definitions as well. For available funding, for budget year 24-25, we have $31 million that is broken down as shown on this table below. If you are wanting to reference this, you are more than welcome to come back to this webinar and review the available funding for each award category. For helpful resources, we do have the links here for Song Brown Glossary, and we also have provided the PCR grant guide. Both of these are also posted on the Song Brown website, and they have also posted the technical assistant guide on the chat as well. For e-application, e-app registration, on this portion here, since most of you have already created an account or profile, we're not going to be going over this process here. However, like I stated earlier, the webinar and the TA guide will be available to you. Helpful tips. Some of the useful information or tips that you may want to know or, follow through is that, the previous and save and next buttons will be found at the bottom of each page. And if you are needing to save your application, you can select Save and Next in the application to save the progress. And if you are wanting to resume your application, you can select Application in Progress and Submitted, and that will guide you to your application where you can then resume. The asterisks on the fields itself are required responses. If you don't fill it in, then of course it's not going to let you proceed. We have also provided tooltips throughout the application. And so if you're unsure about a field and you are wanting more information, if you click on the blue circle with a question mark in it, it's going to give you some type of some information regarding that field that you are required to fill out. So we're going to start the application here. As you can see here, this is the program information page. If you've been with Song Brown, the training program should be available. A lot of the times, if you're returning, then your program information will pre-populate with the information you enter in your profile page. Most training programs, unless they are new, are in the system. You can use the magnifying glass to assist you in finding your training program name. And I like to stress that there are times when there are changes in management or program directors, and it all really depends on how they are putting the name into the training program. And we do want you to do a search for like different versions or different types of names just in case it has already been there. However, if you're not able to find the training program name, please do reach out to us by email. For the address, you will see this address validation feature throughout the application. Just by clicking the box, the new fields will appear. And underneath the training program title, you can select the address button. If you are in a place where the address isn't found, please do let us know, and we can definitely research within our back office to see if we can locate your address. The award category, here you will select the award category that you are applying for. You can apply for multiple funding categories in one application. However, if you are applying for the new program, you are not able to apply for any other programs. And now we're going to go through the new programs for PCR. Okay. So this is an overview of new programs and new programs with Match. As you can see here, Phase A is mandatory to receive any type of new program fundings. The phase you have completed determine which new program application you're eligible for. And if you are a new program, you may not apply for THC, existing or expansion funding if you are applying for the new program. To determine your eligibility for new programs, we're going to go through new programs first, and then I'm going to show you the difference between the new programs and the new programs with Match. As you can see here, with new programs, if you state yes to phase A, B, C, and D, then you may apply for the new program funding up to $1 million. And for the new program with Match here, if you respond to phase A, B, and C, and no to phase D, and you're willing to do a 25% match, then you may be eligible for the new program with Match. The new program with Match and the way it works is that if you were awarded $2 million through this program here, and you are willing to do a 25% match, which will be equivalent to $500,000, then your total budget will be $2.5 million. We're going to go through the new program application. If you are new to Song Brown, when you go through the application, please make sure that you check the box that says new program. Make sure you fill out the contract organizational name and doing business name as well. Please do make sure that this area here, that it does match to the W-9, which is your official IRS document. You can then select the entity group, and then of course make sure that you have the most updated information who the grant agreement signatories are. Like I stated earlier, please do verify with your finance or contracts office to ensure that the information that you're providing on the application is correct. Program data page here. Please do review ACGME accreditation phases A through G and select the best response that best describes the status of each phase listed by selecting yes to phase A, B, or C and no to phase D and G, and you will then be eligible for the new program with Match. And by selecting yes to phase D, A through D, then you may be eligible to the $1 million for new program. And like I stated earlier, if it's no, then it would be the new program with Match. The section here talks about the training sites. If you are selecting yes for new programs to phase D, you will be required to fill out training site information on the next page. Just so if you want to know, all you would need to do is add a site and complete all the required fields. For facility type, when you are entering in your facility type, you can verify your facility type by using the links provided on the application itself. And then on top of that, please do review the information to make sure that they are correct. Payer mix. Payer mix is required for all listed training sites. Payer mix does not have to equal 100%, but must be in whole numbers. And if your training site review button is new, please select yes to move forward. To edit any entries that you have entered into the training sites, you can definitely go to the drop-down arrow, and that will allow you to either edit or delete the entry itself. For the executive summary and program strategies, it is a required field that you will need to complete, and there is a maximum of 2,500 characters per response. Here are the strategies questions 1 through 5. If you are selecting any of these strategies here, you can choose as many as you need per strategy question. Just know that for each selected strategy question, you will have to provide a narrative or an explanation of that strategy and what you plan to do moving forward. For residency training, please indicate how many first-year residents will you initially be accredited for or plan to be accredited for. And if you are doing so, please select your residents who will be training side by side with FNPs and or PAs. Expected expenditures, and this page here displays, we would like you to provide information about how much funding you are requesting based on your expected expenditures and what you are eligible to apply for. And for new programs with Match, you are required to fill out the budget and funding page here. Please provide your anticipated or actual expenses related to each budget, categories listed. And for any strategies or any question or any certain strategies 1 through 5, if you did select multiples, it's going to ask you to upload documents here. This is where you would upload the documents. And once you upload all required documents, it's going to turn green. And if you are needing to delete that document, you can always select on the drop down, and that will allow you to delete that document. And here, if you are certifying that all the information within this application is true and the most current information at the time of the application submission. And once you submit the application, this is the page that you would get. I do want to note that only program directors are able to initiate the application, and they are the only ones who can actually submit the application. If you are listed as a grant preparer, you can only update the application. If you are needing to view and print your application, you can do so by selecting the drop-down in this area here under the Application in Progress and Submitted tab, and this will allow you to view and print your application. Now we're going to go through the application for existing teaching health center and expansion slots. As you saw earlier, you would still need to provide all the request information. If you want to link data from prior applications to this new application, you can use the magnifying glass search function to select the training program title from the list. After checking the box, all you would need to do next would just be save and next to move on to the next section of the application. Your contract administration, as I stated earlier, contract organizational name and doing business as must match what you report to the Internal Revenue Service. Like I stated earlier, please reference the W-9, which is the official IRS document. Select the entity group. The grant agreement signatory, please make sure that they are updated. And then after that, if there is a PO box, you can definitely select that as well. If not, then you can just say no and just move forward. Program data page here. You would just need to enter the residence and graduate data to report, which will allow additional fields to appear once you complete this section. To add a training site, you would just need to select add a site. Or if you are wanting to import from prior years data, on the program data page, you will only see continuity training sites from the prior year's application. Once you do import, please verify that the site information is correct. For facility type of your training site, please verify the facility type by using the links provided on the application, and then only use these provided resources to identify them by selecting the fields noted below. These complete all required fields for payer mix. Just as I had stated earlier, payer mix does not have to equal 100%, but must be in whole numbers only. If you are needing to edit any of the entries that you have provided, you could just go down to the drop-down arrow, and there you can do the edit, or you can delete that field. Here again is the executive summary and program description. We are requesting for an executive summary and program description of the program that you are applying for. There is also a max limit of 2,500 characters. The funding and expenditures are based on what funding category you are applying for. Please provide the number of slots requested for each funding categories. And if you are applying for THC and existing funding, ensure your slots do not exceed your program's total number of approved first-year slots. Annual expenditures for the last academic year is required for all programs except new programs, and you do not need to enter information into the grade fields. These fields will auto-populate with the information. And this section here is for our teaching health center. It is required for a budget summary to be completed. Just note that the total program annual budget must be equal to more than total requested THC Song Brown funding. The aggregate resident data page here. So prior years, we were only collecting the data based on the individual resident level. However, for this year, we are collecting an aggregate for all the years requested. So we would need to provide the total number of ACGME approved slots for each academic year. This section here will require you to enter in the graduate data information before adding each graduate. And to add a graduate, you would just need to click on the Add Graduate button. And if you are needing to make any edits or delete, you can just select on the drop-down arrow, and that option will let you edit or delete that information. For facility type, the same thing as before. We have provided the links here so that you can use to verify the facility type that you're entering in. And if you are needing to edit, then of course, just select on the drop-down arrow again, and that will give you the option to edit or delete an individual. So some common application errors that we have been coming across, like the first bullet here says applicant did not enter any data for residents or graduates, even though the applicant has residents and or graduates. Sometime going through the application, the information is not entered, and if you do have data for that, we are requesting that you do enter that information in. As well as the practice site name and address for out-of-state graduate. This information is only needed for graduates practicing in the state of California. So if you do have a practice site outside of the state of California, that is not a site that we are accepting. They have to be in the state of California. The third bullet here says that, contract organizational name, like I stated and stressed earlier, the names need to match what is reported to the IRS what shows on your W-9. And on top of it, please make sure that you are providing the correct grantee and 204 signatories, so that if your program or your organization is awarded, we are submitting the DocuSign packet to the right people and individuals to complete those forms for you. And if you need to add a training program and you did not search for a previously used training program, do let us know if you're not able to find it. And if you're not able to find it, then let us know, and we can definitely research that information for you as well. So during the process, the required documents here, we would like you to upload the accreditation approval letter or the expansion approval letter here. Once you upload all required documents, it would turn green. And if you are needing to delete the document, then you would just need to select the down arrow to delete. And please make sure that you are agreeing to the terms and condition of this application here, that you're certifying that the information is true and correct. And again, like I said earlier, only program directors may submit an application. The submit button will not appear for grant preparers. Once the application is submitted, you will see this field here where it's the submission completed successfully. And if you are needing to view and print your application, you can go to Application in Progress Submitted and select the drop-down arrow, and that will allow you to view and print your application. And that's the end of our webinar. And if there's any questions and answers, I'm going to hand this back over to Chris. Thank you.
All right, thank you so much, Tracy. That was great information. As you can see, our team has put a lot of work into this program, and we're excited that you've joined us today to learn more. We are going to transition into our question and answer session. The chat option should now be accessible in the menu bar at the top of your screen. I do see a few hands raised. I do ask that we use the chat feature. Helps us make sure that we get the questions in the best way possible answered. We do understand that some of you may not be able to access the chat feature in the browser version of Teams due to your organization's browser restrictions. Some find that the mobile version does provide chat access. If you're still unable to access the chat feature, please email your questions to songbrown@hcai.ca.gov. You can find that link in the chat as well, or you can find it on our website. Thank you for your understanding in that. We are going to answer questions in the order that they are received, and we'll do our best to get through all the questions that you have today. And I see we've already got questions coming in, so all right, let's jump right in here. Hillary asks, what is the review that comes with the early application submission? It's like we have a whole lot here. Let's see. When listing the number of residents, there is force matching of ACGME total approved spots and current total spots. We have one unfilled spot, so it doesn't match. Currently, we have 78 residents, but we have ACGME approval for 79, and I am unable to list the 79 slots since our current residents add up to 78. And then I'll save the second part. Let's get that first part answered first.
Let me go through the question again, okay? We would just, Hillary, you would just list the 78 residents.
Okay, and then the second part is, if they are Taiwanese, should we list other Asian or Chinese? Does other Asian count to URM points? We have residents that are Sri Lankan, Bangladesh, Afghan. Should they be other Asian, and does that give us points?
Okay, to answer that question, Hillary, you can select other Asian, and I think it does do a drop down where you can specify the ethnic group itself too. So it would be like other Asian, and then you can list them as Taiwanese, or if it's other Asian, then you can list them as Sri Lanka, I do apologize, Afghan. That should specify whenever you're selecting that other Asian option.
Tell her it may or may
However, I do want to let you know that, we don't know if that's going to give you extra points or not when you're filling out the application.
The first part of the question, I want to go back to that. What is the review that comes with the early application submission?
So the process, the review portion of it for early application submission, we are looking to see if you have completed the application, if any of the information is missing,
If anything looks odd.
if there's any information that is off or doesn't make sense, because there might be times where they might be like mistypes or information that you may have missed.
We're not at that point.
However, like I stated earlier, if you can submit the early application by that August date, before 3 p.m., then we can definitely review it at that time.
All right, thank you. Let's see. Next question. Can one applicant apply for THC, existing PCR, and expanded PCR altogether?
So, Kelly, one applicant can apply for THC, existing PCR, and expanded if they're eligible for all the programs.
All right, thank you. And I do notice that we have a hand raised, and we ask that you put your questions in the chat if you're able to, or you can email songbrown@hci.ca.gov if the chat feature is not working for you. Other questions do we have out here today? As a reminder, we do have the contact or our contact information and our resources listed in the chat. You can find the links to the residency, the PCR program page, the grant guide, the technical assistance guide, the Song Brown glossary, and the applicant link. You can also find that on our website. Another reminder as we wait for questions to be answered here, the webinar is being recorded, and we will post them in 7 to 10 business days. Any other questions out there today? All right, let's go ahead, since we're not seeing a lot of questions and we do have one hand raised. Let's go ahead and see if we're unable to unmute them and allow them to ask their question. I see B. Afghani, go ahead. You should be unmuted. Go ahead and ask your question.
Hi, can you hear me? Sorry.
Yes, we can. Thank you.
Okay, great. Yeah. There's one question is about the executive summary. Is there a focus in terms of what we need to write? In previous years, there were some focus, like if you focus on some kind of a strategy, is there any focus? Or is it like what we have accomplished and what we are hoping for?
Are you muted?
Hi, this is Melissa I'm the program manager for the Song Brown program. We don't have a specific focus. I think that we ask that you tell us what year your program started, and then we just want to know a little bit about your program. When did it started? When it got started, what your focus is as a primary care residency program. Those kinds of things.
Okay, great. And
We
then we
know
have a hard
that, you
time.
know, the Song Brown funding that we provide to all of these programs is to go towards the education and training of residents to practice in primary care areas. So I would keep that in mind as you are creating your executive summary.
Perfect. Can I ask one more question?
Thank
Sorry.
you.
Yeah, go ahead. Yes.
Yeah,
one more
so
question.
for the ethnicity, I think you mentioned that there is some kind of a drop-down menu to kind of specify the race more, but we're having a hard time getting that. I'll look more, but is that drop-down for sure there? For example, if there's an Asian, can we for sure say that what kind of Asian? Is that available?
I'm fairly certain that there is that race ethnicity categories. It does say like Asian Chinese, Asian Japanese, Asian Korean, but we don't. Some of the ethnicities I think that Hillary asked about earlier are not in that drop down. So you would want to click Asian other and then provide the um, like Tracy mentioned, you know, put in what they are.
So we
So
can
if they were
just type it,
Taiwanese, you
right?
click Asian other, Taiwanese, and we can't guarantee that that's going to get you more points or by putting that in there,
Okay, that's fine.
by
Thank you so
providing
much.
that information, I
So
should say.
we'll just type that out. Asian other, for example, Taiwanese or something else. We can just type it, right?
Yeah, I believe so. Yes, you click Asian other and then a drop down, a text box will appear and you type in, you would type in Taiwanese.
Okay, perfect. Thank you.
All right. Thank you for your question, BF Canny. All right. Let's see. Any other questions today that folks may have? One of the reasons why we do these webinars is to make
Is that
sure
it?
that we can answer all of the questions that program participants may have. So this is your chance to have the experts at hand and get your questions answered. Give about 30 more seconds for people to get their questions in. Again, please visit our website. You can go to hci.ca.gov and navigate to the workforce tab. And from there, you can find grants for organizations, and you'll see the Song Brown page if you are unable to see the links in the chat. You'll find the grant guide, the technical assistance guide, our glossary, and the application links there. Another important note as we wait for any last minute questions is to remember that the application cycle is closing September 10th at 3 p.m. You want to make sure you get your applications in before then. Looks like we might be done with questions, so we'll go ahead and move on. Thank you for your participation. And again, if there are more questions, please email us at songbrown@hci.ca.gov. We do want to make sure that we're here to help you guys navigate this process. As a reminder, we will be posting the recording of this webinar and slide deck on our website in approximately 7 to 10 business days. We do appreciate everybody joining us today to learn more about Song Brown Primary Care Residency Program. We are excited to be able to offer it as a part of our health workforce development efforts at HCAI and are grateful for your participation with us today. You can see our resource slides on the screen right now. One of the ones we really want to direct your attention to is to sign up for our monthly newsletter. You can go to the link right there or hit the subscribe button at the top of our webpage if you're already on the webpage, and you'll see our workforce, health workforce listings there, and sign up for our newsletter to stay up to date with everything that's happening with HCAI workforce programs. And we encourage you to go to the website to discover all of the other great resources that we offer. One more reminder, the cycle does close September 10th at 3 p.m. Thank you all for attending this webinar. And with that, we conclude. Have a wonderful day.